Safe Harbor has been an absolute godsend for this community of Stanwood and the greater Stanwood area. The clinic draws from the whole region, but to have the quality medical care available free of charge to people who have fallen through the cracks in the insurance arena is just priceless.
I originally came to Safe Harbor because I was without insurance, I was homeless, and someone from Snohomish County, GSHS, recommended Safe Harbor so that I could get my medical needs for my diabetes.
Safe Harbor is a 100% free clinic. We don't receive checks from the government. We don't receive checks from large organizations that are helping us do what we need to do. We have an organization with over 200 volunteers that requires a lot of work and a lot of organization.
My name is Jessica DiBari. I'm a third-year medical student at Pacific Northwest University of Health Sciences. It is really inspiring to come here because people are treated with the utmost respect, and patients are the #1 priority, and it is affecting the way I want to practice medicine because I want to make sure that even in my day-to-day practice I include that aspect of being there for the human being.
With Safe Harbor, our mission statement is to take care of not only the physical, but also the emotional and spiritual needs of patients as well. We really believe that treating the entire person is really important for their health.
Well, spiritual care teams up with the nurses and the doctors here to provide a kind of a whole person care. So we've got the physical, the medical, and they're providing spiritual counsel when appropriate. And then when the patient comes for the exit interview, we just want to make sure that we have addressed the spiritual needs of the patient.
We make sure that they have everything they need: comfort, care, love, lots of love. And sometimes it's just a big hug, and they don't get that in a regular clinic.
I've had people cry. I've cried myself. When the Holy Spirit is praying through you as a spiritual care person, it's amazing for you yourself in that experience, but it's also very encouraging and life-giving to the patient, and it opens their perspective and allows the Holy Spirit to touch them spiritually and to come into their life and to speak to whatever it is that they're going through.
When people come here, we're not limited by a schedule, insurance, and so we can really just get to the heart of why people are here.
At Safe Harbor here, I work as a family practice doctor. That's my specialty, and I've been coming here since March of 2012, so about 6 months now, at least once a month, and some months more than that. And also participated in a special outreach project this summer that Safe Harbor did with CMAR at migrant camps for the health screening outreaches.
Many providers who come here to volunteer come here to give back to their community. They come to make a difference, and they come to really realize the reason that they became a provider in the first place, which is to heal patients and to make the world a better place.
I feel like I just got Christmas presents by getting like about 6 months worth of inhalers, and I kind of just wanted to hug the doctor, so I'm really happy, and I'm going to tell other people.
Okay, so patient assistance is basically 3 different things. It's assistance with prescriptions. Most of the drug companies have programs where we can access free medication for people who don't have insurance. The other piece of that is a program called Project Access, which is out of Snohomish County, which is a way for patients to access specialty care that they can't otherwise afford. And the third is to access programs that have financial assistance, not necessarily free, but financial assistance through a couple of the local hospitals that can provide things like MRIs and CAT scans and X-rays.
You know, it's for people who don't have any of the resources and are trying to improve their lives, it's really a valuable resource, and I think it's definitely a worthwhile investment of the community, and to have that resource available, and to, for people to contribute to it.
Well, people in the community come to me all the time and say, I might not even be alive if it wasn't for the Safe Harbor Free Clinic.
It's been great as far as giving me a sense of security and knowing there's a place to go if I really do need help, and not with just the little things, but the really big things.
Interestingly enough, I just saw a patient tonight who moved here recently from North Carolina to be close to her family who live in the area, and she was able to do research online and find out what services we offer here, and it helped her feel much more secure about moving here because she needed to have continual care for some of her chronic medical conditions, and she felt great that this was available in the community and helped her make the decision that she was able to move here.
Safe Harbor Free Clinic apply for grant monies. Usually when we apply for those, they are utilized for special programs, for our chronic care clinic, our mammogram van, any of those type of special clinics. That's usually what the grant monies fund. It costs us about $39 per patient to operate. So when you're talking $25, it's almost to one patient. $500, that would fund probably a month's worth of our supplies for our medical clinic, at least for our regular walk-in clinic. Of course, our chronic care clinic is a little more because of the diabetic supplies. $5,000, you could fund a mobile mammogram van for one day, and that would make it so all of the patients for that mammogram van would get free mammograms that day.
Without the donations, I'm guessing this can't be possible, so I even feel like I want to donate because this is so important, and for me, I know there's a lot more people worse off than the condition I have, so it's very worth it.
I think people should support this program because not only does it reach out to people who are getting started, like me, who are just getting started with their life and maybe don't have a good foothold yet, but people who have things happen to them, like they lose their job, and it's really good for people in all walks of life and in all aspects of their life too.
Patients are very grateful, and when we I have lots of patients who say, well, how much is this going to cost me? And when I tell them nothing, they either smile, or I've had several patients just break down in tears because they can't believe that they're finally going to get an answer to the problems that they've been suffering through.
Most people who come here have been trying very hard, have been working, going to school, and just find themselves unable to access medical care for lack of insurance. And many of them have very serious chronic diseases that without us, they'd probably be ending up very sick and in the ER.
You know, it's amazing. The more people we treat, the more people we learn of that need help, and it's been neat to see us move from just a small clinic in a small town to a clinic who's been used as a model for other free clinics across the state and actually across the nation.
With the healthcare reform passing or becoming law, what is automatically assumed by most people is that free clinics will no longer be needed. There's going to still be 23 million people that will be without health insurance in 2014 when the bill goes totally into effect. So we're not going anywhere, unfortunately. I would love to be put out of a job, but it's not going to happen anytime soon.
When you go to other communities, you don't find a service like Safe Harbor available. Normally they'll tell you it's on a sliding scale. And if you have no income, how can you have a sliding scale? Well, I've got to say, I've always been treated with a lot of dignity here, and they always make sure that they have a friendly smile. There's translators here available to anybody who speaks different languages, bilingual.
I actually had a couple patients tell me that if it wasn't for Safe Harbor that they would have died, so because they can't get the medication they need. So Safe Harbor helps them maintain a quality of life.
Okay. Machu Picchu man. You met my friend the Machu Picchu man.
Nice.
I'm working on it still.
Awesome.